the overall listening test, you have a total of 12 questions. So if you consider the whole test of listening, it is total of 42 questions. If you consider part A, B, and C, out of which you get 12 questions from part C. So if you look at the overall test, this forms hardly 30% of the overall test. So I do accept that it is the most challenging part, and this is actually designed to filter students with advanced level of English. So if you are trying to achieve a level of B, that is advanced level of English. Okay. C plus is intermediate level of English. C is pre-intermediate level of English. So if you are trying to achieve B in OET or 7.5 in IELTS or anywhere above 70 in PTE, then all those three levels are considered as advanced level of students. So if you are finding, while practicing, if you find that listening part C is difficult for you and you are not even able to get 50% of the answers correct, that suggests that you need to work on your English. You need to reach to that advanced level of English. So what we are going to learn today is how you can develop your skills specifically for listening part C. So whenever you are preparing for a test like OET, there are two types of skills that you need. One is your linguistic skills, how fluent you are, okay? And other is your test taking skills. How you handle with, how you handle the test, how you handle each question, how you pre-prepare before the test starts, and how do you improve your score. Basically, how do you convert your language skills into the scores? So sometimes what may happen is students may have a very good level of English, but then they are not able to convert their linguistic skills into the score. When you are trying to apply for a registration into GMC or NMC, what they are looking for is the score, right? So the test taking skills will help you to materialize that into the score. And linguistic skills that you have is something that you work upon while you are preparing for tests like OET. So you need a combination of both. You can't pass the test with just test taking skills. Right? So we are going to learn how to approach the listening part C today. So we'll have to extract, okay, and out of that we are dealing with the extract 1 right now. It has six questions, 31 to 36. And what type of conversation, or is it a presentation or an interview? You can find that out from the context sentence. So it says it is a presentation. What is it on? The topic, treating scoliosis. Who is giving the presentation? By a physiotherapist called John Booker. So the moment you read the context sentence, you start predicting what all points they might have discussed here. So they are a physiotherapist, so you can expect them to discuss mainly the treatment of scoliosis with the help of physiotherapy. And this is going to be a presentation, which means there will be just one speaker, John Booker, who would be giving the presentation. So how do we have listening part C is that in the beginning of the test, you get 90 seconds time for pre-listening or pre-preparation. And once the audio starts, you do not have any pause. Remember, you do not have any pause because the whole presentation will be given at a stretch. The idea that they are trying to convey here is that all the whole presentation is not 6 different topics. It is on one single topic that presentation is given. So if there will be pause, it will really break the thought process, it will break the flow of the information being given. So there are no pauses. You have all 6 questions coming straight away after 90 seconds of pre-listening time. So what you do in that 90 seconds time, how you utilize that 90 seconds time to make sure that you are getting maximum score in listening part C. The first thing, as I said, is we pay attention to the context sentence and the speaker, who is the speaker and what is the topic, to identify a general idea. After that, you start reading each of the question and you try and identify the idea specific to that proportion of the talk. So the entire 5 minute conversation, this conversation in C will be of around 5 minutes, 4.5 to 5 minutes. So the entire 5 minute presentation is on scoliosis or treatment of scoliosis, but within that you will have some subtopics. So here question 1 says, what general point does he make about physiotherapy? So usually it would happen that the first question or the first part of their talk would be a general talk, right? Because they would need to first set up the context for the presentation that they are going to have. Again, when physiotherapist is giving a presentation, and if the listeners are not directly from the physiotherapy background, if they are a nurse or an occupational therapist or a physician or other healthcare professionals, then the physiotherapist would go out to give a brief introduction of what is physiotherapy and how it works. So here also you can see what general point does he make about physiotherapy. So what can I predict here is that they may talk about the approach. How does it work? How do we deliver physiotherapy, or what kind of approach do we have? So this is going to be a general talk, not related to scoliosis, because you see here, it is not related to scoliosis. Similarly, you read all the questions to get a brief overview of, so that you can predict what is going to come next. Second question is about before treating a patient, the physiotherapist needs. So now you can imagine that probably now they are going to talk about treatment for scoliosis particularly, and probably they are going to give stage-wise description. So this is before treating. So before you have developed an action plan for them, what all factors do you consider for that particular patient? Then third question here says, John feels that once scoliosis is confirmed, see how clear the stages are. So once scoliosis is confirmed, the priority for the multidisciplinary team should be. So once the diagnosis is confirmed, what should be the priority of the team? That is something they would discuss here. Then in the next question, what is the topic here? So in the second phase, in John's preferred treatment plan for scoliosis, focuses on. So you can expect that in this part of the conversation, they would describe how the second phase is designed and what does it focus upon. After that, question 5. John believes that success in the final phase of treatment depends on. So here they would talk about the final phase, and here what the success depends on. Okay. And finally, the last question says, suggests that patients with mild to moderate scoliosis often what? So if you see, majority of the questions are saying suggests, believes. Yeah, you can see John's preferred treatment plan. You can see John feels that, John suggests that. So all this listening part C presentations or interviews are mainly about the speaker giving out his own perspective towards that particular disease condition or that particular treatment, therapy, test, diagnostic method, operation, or medication, probably vaccination, it could be. So all the listening part C questions will be, again, just like reading part C, will be based on opinion and attitude. Majority of the questions will ask you to understand the speaker's opinion or attitude towards something. So similarly, because you are tested for opinion and attitude, you would see this presentations or interviews are also highly opinionated. They wouldn't be giving out facts. They wouldn't say that, if scoliosis has happened, then this many muscles or this many bones are involved in it. Not something which you can answer based on your current medical knowledge. So never ever in listening part C, you should finalize your answer just because you think you know that it could never be this way or that way. No, because the interview or presentation that you have in the listening part C basically is not the concrete fact. It is the abstract fact. But again, because it is related to medicine, the speaker would not simply giving out his opinion, or it could not be so much biased, because they will have to prove themselves with some data, some statistics, or maybe their personal experiences or case presentations from their own patients, or it could be research or study or quotes from different experts. But basically, these are not the concrete facts. It is something that is still being debated, something that is still being researched. So that is one thing you always have to keep in mind. Now, just reading questions before the audio starts is not adequate. Reading questions will give you a tentative framework. So now we have got a tentative framework of this conversation, that in the beginning he would just simply introduce what is physiotherapy. In the second part, he would specifically talk about scoliosis treatment and physiotherapy, and he would set up some of the criteria, or the factors that they would consider before starting physiotherapy. Then he's going to talk about some phases: first phase, second phase, final phase, and his own opinion about each of the phase. Now what I would do is I would read the answer options as well, and I would also think in detail for each answer option what could be the possible content of the audio if that answer is correct. So here you can see the question says, what general point does John make about physiotherapy? So this is general point. This is a main idea question, because he's trying to say what is the point that is he's trying to make about physiotherapy. Now, if you see answer choices here, they differ from each other. There is a difference. First one says it allows patient to opt for a less invasive form of treatment. So when you are looking at answer choices, you try and highlight extreme words, negative words, blanket words, or any words that are comparative. If there is a comparison, so here if they say less invasive form of treatment, so this shows comparison, right? So this means there is a hidden comparison between physiotherapy and, or amongst all the therapies, between the physiotherapy and rest of the treatment options. So is he trying to prove that physiotherapy is less invasive as compared to the other form of treatments? It tends to be used in conjunction with other forms of treatment. So you see, A and B are completely different. If in the entire conversation he just goes on to compare how physiotherapy is different from rest of the treatments, then probably A is the correct answer. But if he describes how physiotherapy works in conjunction, in combination with other forms of treatment, then B is the correct answer. And again, you have a comparative language here. There is a comparison. It places more emphasis on prevention than other forms of treatment. So here there is a direct comparison of physiotherapy with other treatments. So when you are looking at answer choices, you try and see how those three answer choices are different from each other. And are there any answer choices which are very close? Or what is that minute difference that can help me to differentiate between those two answer choices? So here I have, answer choice A and answer choice C that are basically comparison of physiotherapy with other treatment choices. but comparison is in different way. Here it is, how invasive the treatment is, and here it is what it is focusing upon. Is it the prevention? Is it the treatment or cure or rehabilitation, for example? Whereas B says, no, there is no comparison. It is, a combination of therapies, or it is a combination that helps patient recover. Similarly, if you look at second question here, it says John suggests that before treating a patient, this is a very, very important keyword for you. Before treating a patient, what the physiotherapist needs to do, what is something that they have to do before treating the patient. So here it says they should develop a treatment plan based on a description of the symptoms. Whereas here it says to establish whether the cause of the condition has been identified, or to determine which of the two main types is being presented. So main types is your keyword here. Okay. If they say just two types, then that's a very different language. And if I say two main types, that's a very different language. Okay. When I say, for example, two of their trainers had come. So maybe they can have 100 trainers and two of them had come. That really doesn't mean that they two were the main trainers. Similarly here, two main types, if they say, then this could be the correct answer. So what they have to basically do before developing a treatment plan, do they need to establish the cause of the condition? Do they need to establish which type are they dealing with? Or they would not worry about the type, they would develop the treatment plan just based on the symptoms, just for the relief of the symptoms, the way we call it as symptomatic treatment. Yeah? So this deep analysis you would have to do. Now, definitely right now when we did it, it took us around 10-15 minutes of time. But this is very, very important. This brainstorming is important. You just cannot skip this, because if you skip this phase, what would happen is when the audio starts, you will feel completely lost because you don't know what is coming next and you haven't made any predictions. So if you have made predictions, you are prepared to listen to a particular thing, and that preparation is very, very important. Okay, so you would realize as soon as I start the audio how important it is to have a grip on the overall presentation as it goes. Now, another challenge that we are going to have here is because it is a one single presenter, there would be no one to tell us that now you should move on to question number 32, right? Because the presentation would come in flow. So how would I decide? So there will be some keywords, like here we have before treating a patient. So this keyword would help me to decide that now this is moving to question number 2. So that's again an important consideration that you would have to have when it is a presentation. So now what I'm going to do next is I will be playing audio only for these 2 questions, and I want you to answer these 2 questions for yourself. Yeah. And at the end of these 2 questions, if you feel that you were not able to answer, and if you want me to repeat it, definitely we will have a rerun, because when you are practicing in the beginning, it is perfectly fine to listen to it up to 4 times, 5 times, particularly when you're practicing on your own at home from the beginners or intermediate. Okay? So it's perfectly fine to repeat and rewind and pause and stop. So now I'm going to play this audio. Here you will not get any pause because we have already done the discussion. So I'm going to straight away start the audio.
As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis. Can physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. A scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one.
Okay, so this was the audio for first two questions. Were you all able to answer both the questions? Okay, please type in your answers. And whenever you type in your answers, make sure you are not sending it to everyone. It should be sent privately to Acumen's account so that other students don't get distracted by what you have typed in. Okay, so yeah, I see quite similarity in the answer choices. Okay, that's great. How about others? I can receive answers only from two of you. Were others not able to answer? Okay, so some of you lost the internet connection and you couldn't answer. Shall we have a rerun then? You want me to play it again? Would hardly take a minute. Sure. So we are going to have a rerun.
As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis. Can physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. A scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part of the...
Okay, so now could you all answer? Okay, so for first one, almost everyone goes with A except one student. Okay, now as we discussed earlier, we are not looking for one sentence here. We are looking for the overall idea of the paragraph. So he did talk about, effective replacement of surgery, but he mentioned clearly in some cases. Let me explain it to you with the help of the transcript. Okay, so if you can see the transcript here, yeah, he started explaining how physiotherapy prevents, treats, and assesses and diagnoses wide range of conditions. It reduces pain, it improves quality of life, improves mobility, and in some instances, so this was not the main point that he was trying to make. So this would happen. See, we are not, you will have to remember when you are dealing with listening part C or reading part C, is that you are not looking at true, false, not given questions. You will hear exactly the same statement in the audio, but what you are looking for is not whether that statement is given or not. You're looking for the overall idea of that 1 minute conversation. So he was not just saying that it can be, every time it can be effective replacement for surgical intervention, only in some instances, but obviously not all condition, he made it clear, can be cured by physiotherapy alone. Help it can certainly do. So he himself accepted the fact that it is just a complementary therapy and not all conditions can be cured just by physiotherapy. So A is not the correct answer here. In fact, B is the correct answer. Because what general point he's made is that it works in conjunction with other forms of treatment. Because not all conditions can be cured by it. And again, basically, he was trying to explain through the whole transcript that how physiotherapy, does everything: assesses, diagnoses, treats, prevents. Then also he talked about repairing the damage, increasing mobility, improving quality of life. So it is not just the surgical treatment or replacement of it. There was no comparison as to how other forms of treatment are more invasive as compared to physiotherapy. So B is the correct answer here, right? So this is red alert for all of you. You may hear the answer option as it is in the audio, but you don't have to get taken away by one sentence or one phrase, because you are looking for general point, not true, false, not given question. Am I clear? Any confusion here? Is any one of you still not able to understand why A is the wrong answer? Or how can I rule out A? Then I'm happy to explain. I can explain that to you. Okay. Then second one. John suggests that before treating, what we should do before treating. So here, now he was explaining how usually it is difficult to establish the cause, but in certain types of scoliosis, it can be determined. Basically, there was nothing about the symptoms as such. So he was trying to explain that specific types can be easier to deal with, that are structural scoliosis, and he explained what is it caused by. It is caused by developmental problems, and functional scoliosis, which is caused because of muscle imbalances. And these both have definite causes, allowing us to create an individualized and comprehensive treatment plan. So because they have definite causes, we can develop comprehensive treatment plan for it. So it is not based on symptom, it is not based on which type we are dealing with, because these are not two main types. He just mentioned them as specific types. Main types and specific types are two different words. Main means they are the most found, okay, or those are the most common types of scoliosis seen. He never said anything in that proportion. He never said proportion wise which two are more common. But there are two specific types which are easier to deal with. So that helps me to rule out the two main types is being presented. We actually, in fact, he was trying to explain we have to identify the cause, whether it was resulting in because of developmental issues, or was it because of muscle imbalances and leg length discrepancies. Okay, so for first question, correct answer is B, and for second one, is also B, whether the cause of the condition has been identified. Because there was clearly nothing about the symptoms. They did talk about types, but they were not the main types. They are just two types. And you have to basically identify the cause. Okay, now let us do this next two questions. Again, here we will do a detailed analysis of answer choices. So here now we are looking for the second stage. Once it is confirmed that this is scoliosis, what is the priority? So here it says to determine the severity. Is that the priority? To agree how exercises will complement medication, or to ensure that their pain is being well managed. So all three answer choices are different from each other. Here you are looking for complement, how medication and exercises can complement each other. Here in the first option, you are looking for, deciding or basing the treatment plan depending on how severe the condition is, or managing the patient's pain. What is the priority for us? And next question, the second phase in Jones preferred treatment. So when they start talking about second phase, then I would come to this part of the conversation. What it is focusing on, what is the focus of the second phase? Again, you try and highlight words that help you differentiate answer choices from each other. So new techniques on various joints. Do we use new techniques on various joints? Are we trying to regain full movement, only affected part of spine. So see how you can differentiate A and B is specifically the affected part of the spine, whereas A is various joints. And C says ensuring the patient has realistic aims regarding the outcome. So this talks about the emotional status. Yeah. If I say realistic aims that the patient has, it is mainly about the patient's emotional status. So what do we have to focus upon? Do we have to focus upon patient's emotional status? Do we have to focus upon new techniques on various joints? Or do we have to focus upon just the affected part of the spine to regain its full movement? So now I'll play for these two questions. Make sure this time you are not relying on one word or one sentence. You are looking for the overall idea that is being conveyed here. And one more thing you can expect here is that here it talks about once scoliosis is confirmed. So this happens to be the first phase and this happens to be the second phase. So that is going to be an important key for you to move from one question to another. Okay, I'm playing it. Go ahead.
Multidisciplinary network of healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis. From here, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. I believe a good, multifaceted approach to this is ideally broken down into 4 distinct phases. The first of these, in my program, is pain relief. Although not all scoliosis sufferers will experience pain or even discomfort, many do, and for these patients, the provision of pain relief assists with compliance and also with corrective or prevention exercises. Physiotherapists have a variety of techniques for achieving this, such as the releasing of tight muscles through gentle massage, acupuncture, the use of supportive postural taping, and various electrotherapy modalities such as ultrasound. Phase 2 is a particularly important step for several reasons. It's for rectifying any imbalances through stretching and strengthening exercises. This often still includes taping techniques until strength and flexibility have increased. Physiotherapy here focuses on both sides of the spine, as well as adjacent areas like the hip or shoulder, depending on what's impacting spinal alignment. The aim is to restore the range of motion of the spine, muscle length and strength, as well as endurance and core stability. This stage is paramount for allowing ongoing treatment in phase 3 to occur. This is because it's there that the patient requires the strength and flexibility gained in phase 2 in order to resume normal activities. These include
Could you all answer both the questions? Please type in your responses. Okay, so again, I can see some commonality here. Almost everyone went for I see. This time, Kathan, you had issue in the audio. I see. Mhm. Okay. Let's see if students are getting wrong answer. Then I would play it again. Otherwise, probably you can do it again from teachable this portion, because we won't be able to achieve our goal if I play all the questions again. Then okay. So for 34, I can see almost everyone went with B. And for 33, some of you have selected B, some of you have selected C, and the others A. So let us discuss 33 first. So there was nothing about medication as such. Yeah. So that was easy to rule out, because what they were discussing here is that uh, a confirmed diagnosis comes with the help of X-ray and other things. And then what is the multifaceted approach that they have is that first thing, the priority, the first of these in my program is pain relief. So maybe not all patients would have pain, but provision of pain relief assists with compliance and also with corrective and preventive exercises. And then there are different variety of ways to achieve this. So nothing about medication as such. They did talk about some physical examination, but that was to confirm diagnosis, not once it is confirmed. Once it is confirmed, what is to be done is to deal with the pain. So they did talk about determining the severity here, when they said that um, how can you determine is with the help of physical examination. And if scoliosis is suspected, then you take the x-ray to find out the Cobb angle that tells you how severe the condition is. Then they work together. So you had two hints to, to help you rule out this option. One is when he said, from here, physiotherapists work closely with doctors. So your question has two hints. It says the focus of the multidisciplinary team is. So multidisciplinary team didn't come when it came to confirming the severity of the condition, right? So A is not the correct answer. Factually, it is correct. You determine the severity of the condition, but that is before the diagnosis is confirmed. Question is asking, once scoliosis is confirmed, then what is the priority, right? And there was nothing about medication as such. So B was clearly ruled out. And C, to ensure that the patient's pain is being well managed, because they clearly said that the focus is upon pain management. Then here, the second phase in John's preferred treatment plan. Here, it's great that almost all of you could get this as the correct answer. So here, B is the correct answer. Right? They did talk about shoulder joint, but they were trying to explain the adjacent joints, not various joints. That was adjacent joints. Yeah. Phase 2 is particularly important step for several reasons. It helps rectifying imbalances through exercises. Okay? And then they were explaining how we work on both sides of spine as well as adjacent areas, so not various joints, and nothing about new technique as such was mentioned. And the aim here is to restore range of motion of the spine, muscle length and strength, endurance, and core stability. So that is why correct answer there is B, regaining full movement in the affected part of the spine. Right? So if you will apply this strategy and Simultaneously, if you will work on your English, because as I told you, it is a combination of linguistic skills and test taking skills, definitely you would be able to get correct answers here. Right? Now for the next two questions, I'm not going to decode questions for you. I'm leaving it on you. You need to decode questions for yourself. You need to decode answer choices for yourself. You have to identify the differences between two answer choices. And then I would play the audio. You have 1 minute's time, maybe, to do this, or maybe 2 minutes time, 1 minute for each question. Yeah, go ahead. Identify the focus of each question, identify the focus of each answer choice, and then I would play the audio. Okay, so now I'm going to play these two questions for you.
As a physiotherapist system, and many do, and for these patients, the provision of pain relief assists with compliance and also with corrective or prevention exercises of the spine, muscle length and strength, as well as endurance and core stability. This stages the strength and flexibility gained in phase 2 in order to resume normal activities. These include sport and recreation, which is the objective most patients have in mind during the treatment process. It's where we aim to restore full function. This is where we, as physiotherapists, need to tailor rehabilitation to the specific patients so they can safely achieve their functional goals. This, of course, includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice. And strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilised. For example, in a case of an unequal leg length, a podiatrist could address this with a heel rise, shoe rise, or built-up foot orthotic. What patients expect to achieve and what is achieved varies greatly. However, those with mild to moderate scoliosis who have a commitment to maintaining their newfound strength and flexibility can expect a full recovery, especially if diagnosed and treated early. Physiotherapy is a vital part of this recovery and prevention and should never be underestimated. So, the next time you're asked, can physiotherapy help my condition? I'd be inclined to give a firm nod and respond by saying, with your commitment, physiotherapy is invaluable.
Does any one of you want me to have a rerun for these two questions? Rerun? Okay, I'll do that for these two questions. There, in between, the connection was lost, so yeah, I do realize that.
As a physiotherapist, most patients have in mind during the treatment process is where we aim to restore full function. This is where we, as physiotherapists, need to tailor rehabilitation to the specific patients so they can safely achieve their functional goals. This, of course, includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilised. For example, in a case of an unequal leg length, a podiatrist could address this with a heel rise, shoe rise, or built-up foot orthotic. What patients expect to achieve and what is achieved varies greatly. However, those with mild to moderate scoliosis who have a commitment to maintaining their newfound strength and flexibility can expect a full recovery, especially if diagnosed and treated early. Physiotherapy is a vital part of this recovery and prevention and should never be underestimated. So, the next time you're asked, can physiotherapy help my condition? I'd be inclined to give a firm nod and respond by saying, with your commitment, physiotherapy is invaluable.
Okay, so now type in your answers. Okay, so for 35, I can see a lot of you have chosen B, and for 36, I don't see some of you sending answers. So what went wrong with 36? Were you not able to answer 36? Okay, let's see. So, okay, that's great. Now 35, yeah. So here it says that you again did hear something about the assistance from other professions. You did hear something about cooperation, but if you see, the emphasis was that the physiotherapist develops a plan, but then he explained it is ultimately on the patient, the most important in terms of full recovery. This relies heavily on partnership between physiotherapist and patient, and then he clarified what he means by partnership. Does it mean that the physiotherapist still work with patient? No, he clarified by this I mean we identify the optimal exercises, and it is then up to them to maintain these exercises throughout the course of their life, because the final phase is throughout the course of their life. And then again, as one supporting detail, they said may be utilized. So it is not the, that is a very important part, or it is something on which the success depends. If it is needed, it is to be utilized. So both the answer choices B and C can be um, excluded, because the other professions assistance is optional, may be required. It's not something that the success depends on. Question is asking what the success of final phase depends on. So he explained very clearly that it is about the partnership, but again it is not ongoing cooperation, because the patients, it is up to them to maintain the physiotherapy exercises at home. So A is the correct answer, not B or C. So almost all of you went wrong here. Yeah, one person could get correct answer. That's great. Yeah. Long-term responsibility is to be handed over to the patient. Okay. And 36. So here this was about patient's attitude. Yeah. How do patients feel about it? Do they find it very difficult? Do they doubt its effectiveness, or don't they have enough encouragement? So here you can see that the major part of the extract focused on how people ask questions about effectiveness of physiotherapy, and depending on that the success ratio can also change. So so next time if you are asked can it help, then I would give. So this is mainly about how people, if they accept and if they maintain this with a commitment, then definitely they can expect a full recovery. And again, it doesn't say anywhere that it is something very, very challenging for them, because again, the word expression used here, too challenging. So when you use too challenging, it is an extreme expression. For example, when I say this, for example, it is if I say this is too much for me. So that means I can straight away say that, what I'm trying to convey here is I can't do it. I'm too tired to attend the meeting. Instead of straight away saying I will not attend the meeting. So this kind of expressions where you see T002, it is an extreme option. Yeah. So here I could see some of you went with C, some of you went with B, but B is the correct answer. Lacking motivation was not clearly, it was not coming across. Just one point he made was that if they have a commitment, they can have it, but whether actually they lack commitment is not given. We were trying to find out how people look at physiotherapy. So here you can see the element of doubt that people have about physiotherapy. Okay, so this is how you deal with listening part C questions. The pre-preparation, and while listening what you do is you try to differentiate between the answer choices. Now for the second extract, what I'm going to do is I'm going to play the whole part at a stretch, so that would also give you, it would be much more easier for you to follow the whole conversation. So I'm getting questions on screen first, all 6 of them. Then I would want you to do the pre-listening task for them, and then we would start the audio. Wait for a moment. I would just need to make sure that you can see all the answers on screen. So I'm just making some adjustments. Okay, so now I have got both the pages on screen. You can see all 6 questions here, up to 30, 37 to 40 are on this page, and then you have 41 and 42 here. So now you can start reading through the questions and paying attention to the keywords in each of the question as well as answer choices. Make sure you read the context sentence. Do not just mechanically read it. Also try and think what would be the possible content for the overall conversation as well as for a specific question out there. Yeah. I would be giving all of you 5 minutes time to do this. Probably you are not having the prints with you, so if you want you can make some notes on a piece of paper if you feel so. I would be having the screen here, but still if you feel that way you can have it. If context sentence, if all of you have been able to now get, then I'm just trying to give you a bigger view, but it's just that I wouldn't be able to have the context sentence here. So now you know that it is about diagnosis of cancer, and they are going to talk about a new tool called Cancer Seek. And here you have a better view of all 4 questions. Particularly pay attention to comparative language in the answer choices. Pay attention to negative words. Pay attention to extreme words. Okay, so now I'm going to play this audio. This one is an interview, so you wouldn't have to struggle much with change of the question, because you will have two speaker speaking, and the interviewee, the one who is asking the question, the interviewer, I'm sorry, would give you a, when the interviewer asks a question, that is the hint for you to move on to the next question.
My guest today is Dr. Christian Thomas, co-author of a study into a new blood test known as CancerSeek. Dr. Thomas, can you tell us what led to the study?
Diagnosis for many cancers is a long and challenging process. Cancer remains one of the leading causes of death all around the world, and it's estimated that by 2030, the number of cancer deaths will almost double. So early diagnosis is crucial to reducing cancer-related deaths. That is, the earlier the disease is diagnosed, the higher the chances of treatment success. But sadly, many aren't caught until the later stages, and this is largely due to a lack of fast and effective diagnostic tools, and that's where research is vital. So that prompted our team to test the latest research on a relatively small group of people, and the findings have been quite encouraging. It could potentially bring us closer to a quick, simple way to detect cancer in its early stages.
Can you give us more details and perhaps explain the importance of the test?
Sure. The test is called CancerSeek, and it's a unique, non-invasive test that simultaneously evaluates levels of 8 cancer proteins and the presence of cancer gene mutations from circulating DNA in the blood. It's aimed at screening for 8 common cancer types that account for more than 60% of cancer deaths. In fact, 5 of the cancers covered by the test currently have no screening test at all, so that alone gives an indication of its significance to the medical world. The use of a combination of selected biomarkers for early detection also has the potential to change the way we screen for cancer, and it's based on the same rationale for using combinations of drugs to treat cancers. Circulating tumor DNA mutations can be highly specific markers for cancer. So, to capitalize on this, we sought to develop a small yet robust panel that could detect at least one mutation in the vast majority of cancers.
What kind of success rates has it shown in detecting cancer?
It's been a very positive study. From 812 healthy controls, it produced only 7 false positive results, so that was very encouraging. The test itself was evaluated on 1,005 patients with non-metastatic stages 1 to 3 cancers of the ovary, liver, stomach, pancreas, esophagus, colorectum, lung, and breast. The median overall sensitivity, or the ability to find cancer, was 70% and ranged from a high of 98% for ovarian cancer to a low of 33% for breast cancer. Still a reasonable result and above what we anticipated. For the 5 cancers that have no screening tests at present, which are ovarian, liver, stomach, pancreatic, and esophageal cancers, sensitivity ranged from 69% to 98%.
That's very impressive. Your team must be very pleased. Is there any downside to the test?
Many of the most promising cancer treatments we have today only benefit a small minority of cancer patients, and we consider them major breakthroughs. If we are going to make progress in early cancer detection, we have to begin looking at it in a more realistic way, recognizing that no test will detect all cancers. We may only be in the beginning stages, and although CancerSeek doesn't pick up every cancer, it identifies many more that would likely otherwise go undetected.
What impact are you expecting this to make right away on the general public?
This test represents the next step in changing the focus of cancer research from late-stage disease to early disease, which I believe will be critical to reducing cancer deaths in the long term. As I mentioned, CancerSeek is non-invasive, so can, in principle, be administered by primary care providers at the time of other routine blood work. This has the potential to substantially impact patients' current levels of access. Earlier detection provides many ways to improve outcomes for patients. Down the road, optimally, cancers would be detected early enough that they could be cured by surgery alone. But even cancers that are not curable by surgery alone will respond better to systemic therapies when there is less advanced disease.
And what about affordability for those undertaking the test?
We feel that a test that will be used routinely for cancer screening must have a cost in line with or less than other currently available screening tests for single cancers, such as a colonoscopy. For example, the average out-of-pocket expense for that procedure is anywhere between $1,000 and $3,000. We envision that the CancerSeek test will eventually cost less than $500. Of course, much larger studies of the test are currently underway, and cost can't be a determining factor over quality, but I'm very confident that we will be able to keep it at the estimated level.
Okay, so I hope all of you were able to answer all 6 questions. Is there any specific question that you want me to play again? $41, okay. Definitely. So just the last part of it, right? 41, okay. I would do so.
My guest
It's
today.
the next step in changing the focus of ages, and although CancerSeek doesn't pick up every cancer, it identifies many more that would likely otherwise go undetected.
What impact are you expecting this to make right away on the general public?
This test represents the next step in changing the focus of cancer research from late-stage disease to early disease, which I believe will be critical to reducing cancer deaths in the long term. As I mentioned, CancerSeek is non-invasive, so can, in principle, be administered by primary care providers at the time of other routine blood work. This has the potential to substantially impact patients' current levels of access. Earlier detection provides many ways to improve outcomes for patients. Down the road, optimally, cancers would be detected early enough that they could be cured by surgery alone. But even cancers that are not curable by surgery alone will respond better to systemic therapies when there is less advanced disease.
And what about affordability for those undertaking the test?
We feel that a test that will be used routinely for cancer screening must have a cost in line with or less than other currently available screening tests for single cancers, such as a colonoscopy. For example, the average out-of-pocket expense for that procedure is anywhere between $1,000 and $3,000. We envision that the CancerSeek test will eventually cost less than $500. Of course, much larger studies of the test are currently underway, and cost can't be a determining factor over quality, but I'm very confident that we will be able to keep it at the estimated level.
Okay, so this time what I want to do is I'm going to ask each one of you, to justify one question. Would that be okay? I would ask each one of you to explain what answer choice have you selected and what helped you select that answer choice. And if there is an further explanation needed, I would pitch in. So this would give me a concept check. It would help me understand if you are actually able to follow the strategy that we just discussed, or are you still just randomly selecting the answer choices and you're getting some correct and some wrong. So I don't want that to happen randomly, because I want you to logically understand. Part C is all about logic. So I want you to logically understand and answer those questions, right? So let us start with the first question, which is a straightforward question where it says why Thomas and his team decided to do this study. So can I start with Pankti? Pankti, are you there in the class today? I can't see her name though.
Yes, ma'am.
You're there? Okay. So yeah, can you explain us, Pankti, what answer have you selected for 37 and why?
C, ma'am.
Can you tell us why? Your answer is correct, but can you justify that? Do you remember any sentence or phrase or any portion that he explained and it helped you to rule out other answer choices? Why didn't you go with B or A, for example? It's okay, don't hesitate. Everyone is here to learn, so it's okay to make mistake.
Actually, I didn't remember
You don't
right
remember.
now. Yes.
Okay, yeah. So basically, why C is the correct answer here is because they said that you know, we needed a tool that can quickly detect the cancer. That was the option which could have helped us, which can help us to treat the patient. The early diagnosis was very important, and till that point of time, there wasn't any test which could detect it early, and that is where the research is vital. So that prompted our team to test the latest research. So they didn't say that there were trials which were going on, but they were very slow. No, basically there were no tests which could help us detect early. And that is the reason why they decided to, I'm sorry, go with trials or studies. So C is the correct answer here. Okay, then second one, the new test is particularly important because of. So can I ask Kathan here to explain what answer have you selected and why?
Yeah, ma'am.
Please go ahead.
Yeah, I selected B.
Hmm.
So uh, A was ruled out because yeah, it was a non-invasive procedure, but
Hmm.
the Dr. Thomas did not give much importance to that. He
Hmm.
gave importance to the various type of cancers which we were unable to detect before the
Yeah.
test.
Hmm.
So because of cancer sick, we can detect that now. The
True.
main file. That's
Yes. Okay, so he was explaining how there are specific cancers which would have otherwise gone undetected. So he was explaining how it is to be done. So it basically, it is a kit through which it can be done. It is a non-invasive test, okay, and it basically detects the presence of mutations in the blood, but it mainly aims for screening for 8 common cancer types. So this is one advantage. And another advantage is that the 5 of the tests that it covers cannot be detected by any of the other methods. That is why he thinks it is particularly important. Yeah, so the correct answer that we have here is this. Okay, then for this question, he says the success rate of the test in detecting cancer. What is his opinion? See, again, here you could have noticed that all the questions are about opinion and attitude of the speaker. So, can I ask Faiz you to explain what answer have you selected in 39 and why?
I have opted for C.
Okay. Can you remember any of the sentences or phrases that helped you to rule out A or B?
Yes, I was confused about B and C
Mm-hmm.
because regarding the option D, there were sentences like it carries a range of diagnosis like 33% to 68%, and different statistics were given there.
Yeah. So statistics were given. But if you see, if we had done pre-listening here, this was very easy question because this says disappointing, and this is also negative, two variable. So what answer you have selected is correct. It is appropriate. Okay. How we can get this appropriately is while pre-listening, if we differentiate in the answer choices, both answer choice A and B are negative, whereas C is very much positive, outperformed the team's.
Yes, and ma'am, expression of that, the one which was
Yeah.
asking the question to Dr. Thomas, so I went for C.
Yeah, true. And Dr. Thomas' tone throughout this conversation, right? He sounded so excited about it.
Yes.
Tone of the speaker can help you, the words that they choose can help you. And in pre-listening, if you are able to differentiate the the answer choices, so two variable, as we just discussed before, that whenever you have this TOO2 expression goes into extreme negative direction, instead of straight away saying no, they would say that two or two, like it didn't give very clear picture, that is what it means, B. And disappointing in case of some forms of the diseases, so both were going in negative direction, whereas what the speaker was saying was mainly positive about the test. So I just get the transcript here. He first went on to give some statistics. This is very, very common for listening part C. So he explained how 812 healthy controls were there, and only 7 results were false positive. So it is very encouraging. So you have 1 positive here. Then he said it can detect all these types of cancers. Okay, and the overall sensitivity was 70%. That is quite a high sensitivity. And sometimes it was 98%. But whatever it is reasonable and above what we anticipated. That is why the word outperformed. Outperformed means it performed better than what they had expected from it. And particularly because 5 cancers which cannot be tested by other tests, in that also this particular test showed a sensitivity of 70 to 98%. So all the statistics that he gave out were very, very positive. His tone was he was quite exciting while describing.
See that, ma'am, the response in that below line, that's very impressive. Your team must be very pleased.
Yeah, your team must
I
be.
decided from that point.
Yeah, that is also very helpful. It's very impressive. So it gives out a positive tone there. Yeah, that also can help you decide. Okay, then for the next question, which is, yeah, again here, the question was about downside, what he says about the downside of the test. He was asked about downsides, and what has he explained is something really opposite to that. So Krishna, can you explain what answer have you selected here and why?
Ma'am, I selected C.
Can you tell us why?
I couldn't explain.
Just try it so that I understand whether you logically selected it or whether you just randomly chose.
Honestly, in question they ask about downside, but in paragraph they only said about the positive way, and the answer also given in the positive way.
Yeah.
According to that, he emphasized only on greater impact of their work. So I choose C.
So here we had all the answer choices positive, more reliable, then it eventually it would prove effective across full range of cancers, or would it have a greater impact than other developments? So basically here there is a lot of comparative language for option A and option C. You can see comparative language, and this was whether it would be helpful for detecting all types of cancers. So he has clearly ruled it out that no test can detect all cancers. So that helps us to rule out B. I would just show you with the transcript. So he said that he straight away went on to comparing. He said that most promising cancer treatments we have, they are only beneficial to a small minority, but still they are considered to be a major development. So if we are going to take this cancer seek, if we look at it in a more realistic way, there will be no test which can detect all cancers. There cannot be any test which can detect all cancers. So that helps me to rule out B. Okay, and he said that we are only in the beginning stage, and also it doesn't pick up every cancer. It identifies many more that would likely otherwise go undetected. So he was explaining that, yeah, there are some limitation of this test, but then if you compare it with the rest of the options that you have, all those options also have some limitations. So therefore, yeah, what answer that you have selected is correct, have a greater impact than other significant developments in the field, because the entire portion was having comparison here. Has anyone selected A or B, or would anyone like to argue against C?
Ma'am, I have opted for B.
Okay. So you had two sentences which helped you rule out B, because he said that no test can detect all cancer, and similarly cancer seek would not also be able to detect all cancer. So he said that although cancer seek doesn't pick up every cancer, it identifies many more that would otherwise not be detected. So that is something which would help us eventually prove effective across full range of cancers. No, it may not be, because not all, other breakthroughs that we have that are also limited to a particular population, but still we consider them as a major development. And he is emphasizing right from the beginning that the main benefit of this kit is that it is able to identify the most common ones. So he sticks to that point, that definitely he accepts that it cannot detect all cancers, but it is able to detect the most common ones. It is also able to detect the one which are not detected by other tests, and it is able to diagnose those cancers early enough. So full range of cancers is not the correct word that he was trying to suggest. So that helps me to rule out B here. So always underline the words which, are going in extreme positive or extreme negative. So this is extreme positive, full range of cancers. Then here comparative language, more reliable than it initially appears, and greater impact than other developments in the field. Yeah. Do you all agree now? Shall I move on to next question? Okay. The main benefit of cancer treatment. What is going to be the main benefit? So I can see Praful here. Can you explain, Praful, what answer have you selected for 41?
Ma'am, A.
A, okay. Can you tell us why?
I can't, ma'am.
You don't remember? Okay. Would anyone else like to describe? Would anyone like to pitch in? What answer have you selected? Maybe Kathan, you can try. What answer have you selected and why?
Yes, ma'am.
Yeah, go ahead.
Ma'am, I have selected B
Mm-hmm.
because Dr. Thomas said that the cancer seek was non-invasive test, so it can be done by primary healthcare
Mm-hmm.
worker,
Mm-hmm.
and so can provide larger access than the previous.
Yes, it can improve the accessibility of the test. Yeah, so correct. B is the correct answer here. They did talk something about surgery. There was nothing about patient-centered approach though. So I'll show you the transcript here for this. And her question was also specific. She was asking how it would be beneficial for general public. So they explained that, it is detected early and it is critical to reduce cancer deaths in long term. It is non-invasive, so it can be administered by primary care workers, and that is the reason it can impact the current level of access. And then he went on to say how, because of early detection, the outcomes will increase and some of the patients can be cured by surgery alone. So A goes exactly opposite to this. Here it says fewer patients may need to undergo surgery, but he's trying to in fact say that patients will be cured with surgery alone. They wouldn't require any further treatment, and they would respond better to other systemic therapies as well. So the main benefit is that it can be easily administered, and therefore the access would be easier. People can easily get access to this kind of test. Okay, so for this, B is the correct answer. Large number of people. And last one was about the cost of the test. Here he went on to explain how the cost is comparable to other treatment options or other tests that are there. So it is favorably, it compares favorably with other tests. So A is the correct answer here, with other available methods, because he definitely didn't say that it could be reduced. He ended this conversation by saying that we can't compromise quality for the cost. So explained that it must have a cost in line with or less than other currently available screening. Then he took example of a colonoscopy, and then he explained that the cancer seek will also eventually cost less than 500. So there are a lot of studies, but cost can't be a determining factor over quality. And he's trying to say that I'm very confident that we will be also able to keep it at the estimated level. It is not that it would reduce, but it would remain at the estimated level. And if you compare it with other test options, it is comparing favorably. So A is the correct answer here. So he did not say that it will be reduced because of more, like if this was the correct answer, B, then he might have said that we are predicting that this test will be used and in this numbers, and as we do bulk production of the kit, the price will fall down. Yeah, he did not describe about the bulk production or increased demand as such, but he was hoping to keep the price at the estimated level, so not reduced considerably. So again, this is the key. If you underline negative extreme words or words that help you differentiate, and results of further trials will make it much easier to calculate. They have already made a calculation, the estimation is already there. So C can also be ruled out. So compare favorably, because he's basically doing a comparison. That is where his first sentence also started with, when he said that we feel that a test that will be used routinely for cancer must have a cost in line with other screening tests. And then, for example, he compared it with a colonoscopy. So now let me know, out of 6, how many of your answers were correct here? Write the number of answers that you got correct.